Well, I'm Annie and I care for my son. I've been caring for him for 35 years. He was born with a deprivation of oxygen at birth, and that caused a cerebral palsy down his left side. And then later on, when he got to about 17 and a half, 18, that manifested itself into schizophrenia. So I've been looking after him for all these years, and more recently, in the last 2 or 3 years, been looking after my parents for my mum who's had a stroke and for my dad who's got Alzheimer's. So I think earlier on, when my son was born, you didn't really realise that you were a carer. I was his mum and there to look after him. So for a considerable amount of years, I never really classed myself as a carer. It was only when he started with the more complex mental health problems that I realised I was a carer. And we were put in touch with the care support team, and I think it was definitely the care support team from the trust that really helped us, really helped me, and signposted me to the various places that I could be given some help and support. And from there went to a care support group, but was quite horrified at hearing all the horror stories from other carers, which when I came out of there made me think about that and sort of drove me on to think, why is this happening? And I need to do more about this. So I then became more actively involved, much more actively involved with the mental health services. And up to date now, I'm carer governor for the Leeds and York Partnership Foundation Trust and a trustee for Carers UK London. And just as importantly, involved with the work of the university, which is brilliant. One of the campaigns that I took on was the banking, because the bank had stopped me from going online to bank online for my son. I'm a deputy through Court of Protection for him, and they stopped me banking online for him, saying that I was using the online banking illegally by having 2 service usernames and 2 passwords, because obviously I had my own account and then got my son's account. So they just put a hold on it and just blocked me from it. So obviously I went up to see my local branch and took that through the formal complaint procedure. This probably took, on the whole, probably nearly 18 months, 2 years, because it went up to the ombudsman, the adjudicator, and to my MP, and to the newspapers. And eventually the outcome from the adjudicator was that they should give me my online banking back, because the only thing stopping them from doing that was their own systems and policies. So the bank actually appealed against the adjudicator's decision, which it can be enforceable in court if they're not going to take that on board. So the whole case had to be reviewed again by the ombudsman, and the outcome was that they had to give me my online banking back. In the meantime, this also went through to the House of Commons for a debate on carers and online banking. So it's work in progress, is that, because I have got a meeting with the minister at some point, which I'm waiting for, and hopefully to go on to improve better banking for carers and service users. The whole thing about the university is that they support you with all these things. I've had a lot of support in the banking campaign with the trust and with Carers UK in particular. Being involved with the university has given me the opportunity to be able to come in to talk to student nurses and student social workers about my lived experience as a carer, which deals with all aspects of the experience that I've had as a carer. and also as a campaigner for carers' rights. I just feel passionate about mental health issues and about education. And because I used to be a teacher, gave up teaching to care full time because it was affecting my health, was the caring, and felt that I just couldn't cope teaching and then having to care as well. So my life just took a completely different direction into caring and has led me on to do all these things. So being able to come into the university and talk to students about whatever aspect I'm asked to talk about. This could be anything from sectioning to to direct payments, to all the different experiences that you've had. And to be able to do that sort of keeps my hand in at teaching. That academic side of my what I thought was going to be a very long career and a wonderful career just stopped short. So to be able to still have that academic challenge with the university is brilliant, and because you start to feel valued and recognised as an individual again. I just feel passionate about it because I know that the students that I'm speaking to are the future nurses, are our future social workers, and whatever they can take away from my experiences, for them to be able to look at policies and and services provided and make them better in the future, then I feel that that's all been worthwhile. Yeah, the involvement advisory group is, yeah, that's really good as well. I enjoy that because we get to give our opinions on. Well, I think we're sort of used as a consultation group as well, so we'll get different areas from the university coming in to talk to us about whatever product or service or whatever they might be designing, and they'll come and talk to us and ask us from a carer and service user's point of view what we think about that particular design or module or policy or whatever it might be. And that's really fun to do. And again, there's a big benefit there to the public because we can give our experiences and say, well, yeah, that's going to be a good thing, or that's not going to be so good. I can't see how that would work. And they take all these issues on board. And if that helps them to go back and make that product better for the patient that's going to be using it, then again, we feel valued and that we've contributed towards the work of the university. I would say definitely get involved. Well, definitely, because everyone's got their own experience, everyone's got their own lived experience, whether you're a carer or a service user, and they've all got a different story to tell.